We're looking at the kidney right here. This is the ureter. This is the renal pelvis. And this will be a major calyx. Okay, plural will be calyces. Okay. And where the renal papilla drains directly into, that region will be the minor calyx. Plural will be minor calyces. Okay, right here. Okay, now this outer region, this is the renal cortex. Inside, this is the renal medulla. All right. Each of these sort of triangular shaped regions, these are the renal pyramids. Between the renal pyramids, that region will be called renal columns. Okay, I think the renal columns are more visible in this model. Renal column, renal column. The tip of each pyramid is known as the renal papilla, or the papilla of the pyramid. Okay. Renal pelvis and the ureter, let's see. Okay, and you should be able to see that the renal corpuscle, okay, is here, is in the cortex, okay, as well as the proximal convoluted tubule, distal convoluted tubule, as well as part of the collecting duct. Okay. And those white little dots you see here, those are the Bowman's capsule. The loop of Henle will dip into the renal medulla. Okay, here you can see that collecting duct, but the collecting duct is really partially in the cortex, and the rest of it extends into the medulla. Okay, and then drains into the renal papilla and then the minor calyx. Okay, here you can see the renal artery. This is the segmental artery. So segmental artery. Interlobar artery. Okay, arcuate artery. If you zoom in, you can see these radiating outward. These will be the cortical radiate arteries, also known as interlobular arteries. Okay, and then where they branch further into, those are the afferent arterioles. Okay, so this is the cortical radiate though. They radiate into the cortex. Okay, and the veins that run next to the arteries will be named accordingly. So these will be the cortical radiate veins, and this will be the arcuate vein. That will make this one the interlobar vein. There's no segmental vein, but this will be the renal vein. All right. And then here, on this part of the model, you can see this is the collecting duct. If we follow the path of filtrate formation, okay, so blood flows into this cortical radiate artery and then into the afferent arteriole. It's then filtered. This is where filtration occurs. Okay, remember that glomerulus? So this is the glomerulus. Okay. And here is a close-up of the glomerulus. Okay. These are podocytes, and then we have the endothelium lining the glomerulus. Okay. So the molecule that's able to pass through that endothelium and the basement membrane and then the podocytes, those molecules are typically small molecules. They are filtered into the Bowman's capsule. Okay, so this whole structure is known as the renal corpuscle. The renal corpuscle has two components. One is the glomerulus, the other is the Bowman's capsule. The Bowman's capsule can be further divided into two layers. Okay, one's the visceral layer, which are really the podocytes. The parietal layer is this outer layer. Okay. This is simple squamous epithelium. This is also simple squamous epithelium. Okay. And this portion will be the proximal convoluted tubule. Here you see how the epithelium changes into simple cuboidal. Okay. So anyway, the blood enters the afferent arteriole. You can tell the difference between afferent versus efferent in that the efferent is narrower. Okay. The afferent arteriole is wider, and that creates a high hydrostatic pressure inside the glomerulus, which helps push those water molecules along with small solutes into the Bowman's capsule. Okay. This is the part of the distal part of the ascending limb loop of Henle. Okay. And so this structure is the juxtaglomerular apparatus, or juxtaglomerular complex, JGA, JGC. Okay. And these will be the granular cells. Okay. They are specialized smooth muscle cells in the afferent arteriole. The macula densa cells are here. They're specialized cells in the distal part of the ascending limb loop of Henle. Okay. Now, if the whatever stuff isn't filtered into the Bowman's capsule, will continue flowing into the afferent arteriole. So coming from the afferent arteriole, the blood then enters into the peritubular capillary and vasa recta. Okay, so it can really enter into the vasa recta directly or through the peritubular capillaries. Okay. And then here you can see those peritubular capillaries eventually drain into cortico-radiate veins and the arcuate vein. Okay, interlobar vein, and then the renal vein. Now, for the filtrate that's inside the Bowman's capsule, they continue into the proximal convoluted tubule, and then the descending limb loop of Henle, the ascending limb loop of Henle, okay, and then the distal convoluted tubule before draining into the collecting duct. And here you can see that the collecting duct extends from the cortex into the medulla. Okay. On this side of this part of model, this is a cortical nephron. You can see it's got a shorter loop of Henle compared to this one. This one is a juxtamedullary nephron. It's got a long loop of Henle that extends deep into the renal medulla. Okay, and this kind of structure is important for concentrating urine. Okay, and that's something you'll learn in greater detail when you get to physiology. Here you can see that different distal convoluted tubules or distal convoluted tubules from different nephrons drain into a common collecting duct. Eventually that collecting duct is going to drain into the papilla. Okay, papilla. Once again, this is the vasa recta. Okay. In this model, you can see the kidneys, the suprarenal glands or adrenal glands. Okay, this is the abdominal aorta. If you recall, this is the celiac trunk. We have the superior mesenteric artery and inferior mesenteric artery. It's not on your worksheet for this unit, but I want you to notice that the renal arteries come off at around the same level as the superior mesenteric arteries. Okay. Between the superior and inferior mesenteric arteries, you'll find that's where the testicular or the ovarian arteries stem from. Okay. If you're not sure if the cadaver is male or female, you can just say gonadal arteries. Okay. So gonadal arteries in men will be testicular arteries, but in women, they're ovarian arteries. Same thing with vein. Okay, you can just say gonadal veins. Okay. So this is the right testicular artery. This is the left testicular artery. Notice that they both stem directly from the abdominal aorta. Also notice that even though the testicular or ovarian arteries are pretty symmetrical, but the veins are not. Okay, so the testicular vein on the left side drains into the renal vein, the left renal vein, whereas the right testicular vein drains directly into the inferior vena cava. Okay, so renal arteries, renal vein. Okay, and then at the bottom of the abdominal aorta, it bifurcates into the right and left common iliac arteries. Okay. I'm not sure if I took a better picture of this one at a different angle, but oh, actually you can see, okay, so this part here is a common iliac artery, right? So here you can see it branching. Okay, this becomes the external iliac artery. This is the internal iliac artery. Specifically, this is the left external iliac artery. This is the left internal iliac artery. Okay. If you view this model in a slightly different angle, you'll be able to see the branching here as well. Okay. Now, what else can we see here? This is the bladder. Okay, these are the ureters. Okay. Yeah, I think that's all we can see here. So in this model, we can see the kidneys once again. Okay, I've already gone over the vessels, so I won't go over that again. You can see the adrenal glands here as well. Okay, these are the renal columns, just to point them out again. Okay, renal pyramids, okay, papilla, and then the minor calyces, major calyces, renal pelvis, ureter, renal cortex, and then if I ask you to identify the layer here, it will be fibrous capsule. Okay. Okay, common iliac arteries and veins. Okay, here we have the detrusor muscle. This is the bladder, right? It's got detrusor muscle in there. Okay, inside's lined with transitional epithelium. This region, the triangular region, is known as the trigone. Okay, so I've added that to the worksheet. This is the trigone. Okay, these are the ureteric orifice. I don't think it's in the lab worksheet. So, but you should know that this is the trigone. Okay, this is the prostate, and this is the urethra. Okay, and you'll have to identify different parts of urethra in men, but we'll go over that when we get to the male model.